Welcome to this pelvic girdle tutorial. Thanks to your requests, I'm gonna focus on this region of the body and how we can address it if there's any so-called SI joint dysfunction, so potentially pain, discomfort in the area between your sacrum and the back of the pelvis, or also mentioned or referred to as pelvic girdle dysfunction. But in order to understand the full picture and to understand why we do what we do, I'm going to go into the anatomy, and we're going to look at the structure that relate to this joint. So just to repeat, you see I'm having my girdle here, the new strap around my waist to kind of represent the pelvic girdle and what that is. And it's basically the active structures that support this region, this ring around your pelvis, going all around here. And the structure it supports is, for once, the SI joint. So we have this connection between the sacrum and the back of the pelvis, the ilium bone, right, which is referred to as SI joint, sacroiliac joint, which is a structure that's heavily ligament supported. That being said, if the ligaments are potentially stretched out or softened through hormones, that region of the body can get loose and cause major discomfort. Then from this part of the body, we have the front of the pelvis, which is also connected to a structure that can be heavily affected by hormones. Yeah, the symphysis, which typically, for example, for childbirth, it softens, and so therefore it's ideal when that is elastic, it makes room for the baby. But if it's not completely stable, it can cause major discomfort. So those are bone structures. Now the active supporting structures we need to look at is, for one, starting at the bottom, the pelvic floor, which needs to hold and support all the inner organs, okay, from the bottom. From the top, it's the diaphragm, our main breathing muscle. So that structure needs to be free to contract. Or potentially with the exhale, release back, but to kind of create a active support, when, for example, when we're lifting or adding weight and compression to the back of the body, sacrum region. Good. Pelvic floor, diaphragm. From the front, we got the abdominal muscle, but the one structure that's really key for active support is the transverse abdominis, the deepest, body's closest structure. It goes horizontally out of the lumbar fascia, around here, and connects the front of the body. Yeah, that feeling of hugging your belly towards your spine, or in other words, that feeling of moving the frontal bones of the pelvis towards one another, that is your transverse abdominis, the lower part. There's also the upper part, which is more that feeling of moving your frontal ribs together, and the thoracic transverse abdominis. But in terms of the lower back, sacrum region, the lower transverse abdominis is more key. Okay, so you got another structure to think of from the front, and then from the back, of course, you got all the back muscles that can disturb the regular function of the pelvis. Yeah, if they're tight, potentially QL, quadratus lumborum, or part of the entire lumbar fascia, which is 3 layers, right? So if anything in that region feels tense and hurts when you press into that tissue, then potentially you have a dysfunction there, or not an optimal nourishing of the structure of the tissue that causes some painful spots or dysfunction in terms of the whole, in terms of the pelvic position, in terms of how muscles recruit, and so on. So we get the bottom, we get the top, we got the front, we get the back. Yeah. Here, the deep erector muscles are very key to support. So the more rounded we are, the less engaged the stabilizers of your back. So that need to actually lengthen your spine, to erect your spine is key for the small muscles. Do you feel them right away, right? There's not much going on when you're round, but when you erect yourself, they're charging up. Those muscles, they need to be trained, they need to be active, they need to be recruited in order to support your skeletal structures. Now, one structure besides, as an active structure, so we just flip at that, yeah. Pelvic floor, diaphragm, deep calm breath, and more for that deep cup breath. Deep abdominal, transverse abdominis, and supporting of the back muscles. Motility as a support, but also the regulation of all the back muscles for optimal recruitment is one thing. Then the other structure we cannot ignore when it comes to the pelvis is here. Yeah. All the muscles that are right around the hip joint. Now, of course, when some of the structures are one-sided or tight or insufficient, they affect the positioning of the pelvis. So when I think of the hip in terms of the pelvis, related to the pelvis, yeah, I always want to know, how's my hip flexor doing? Yeah. The structure in the front, because that structure is not only moving my hip joint into flexion external rotation, it actually goes over the entire SI joints through the body, the entire lumbar spine. So if that structure is in a condition where it's not optimally functioning, it can majorly affect the happiness of your pelvis or the dysfunction in your whole pelvic girdle region. Okay, so psoas that we will address. Then, how is the adductors here? If, especially one-sided, the adductors, the muscles that come from symphysis, sitting bone to the inner muscle as bone of the leg, yeah, and they pull the leg towards up. If they especially are one-sided, I will demo that. They're one-sided tight. You see, perhaps, for example, through asymmetric standing, or maybe you'll be carrying your children on one side of the hip, or when you're tired, you collapse. You know, if it's one-sided shorts, yeah, it will uneven your pelvis. Not just uneven, it potentially even twist part of your torso or the other way around. Yeah. So we need to address the inner leg and regulate these structures here to create a good condition to now build strength and support into the pelvic region. Good. So we already said we want to build here. See how the psoas is doing. How can I produce length without having an effect of the lumbar spine? Yeah. How is my condition here on the inner leg? And of course, how is the support on the outer hip? And this support, glute medius, needs to be quite strong in order to level the pelvis. Of course, we cannot forget the back, yeah, the glutes. The more support they offer, the more they release the psoas and transverse, yeah, as their direct antagonist to the psoas. Okay. So when looking at SI joint issues, we haven't even mentioned the hamstrings, but let's stay broad for now. We must look at the bigger region of this part. Okay. So what's happening in the lower back structurally? What's happening in the hip joint? Regulating that, and then bring strength and support to the structures that make you feel supported. Next up, we'll look at the regulation. Let's regulate the structure around the region of the pelvic girdle to then have a very efficient access to the support. I wrap the strap around my waist to increase the awareness of the region that I'm working on. So you simply move into lastly and then give it a nice tug. And you can even, if you need the support right now, perhaps you're more acutely in pain, you just tighten to the point where you feel like an active support. It should immediately elevate the feeling of freedom, yeah? And that way you can focus your mind on this body region. So, I'm gonna start with a wide-legged stand, and exactly, just get an idea of our pelvis position, yeah? Where does it tend to go? And then from here, just take wide-legged stretch of the inner legs and get a feeling of your adductors. Start to really activate your feet and lengthen the body. And just observe, is there one side and that feels tighter or constricted? Which side is freer? And usually there is a strong relation to freedom in your hip, yeah, and to support your body is able to give you in the pelvic region. And then from here, we're just gonna go a little deeper. So I'm gonna move my hands around, move over and lift the toe, but make it to a level where your adductors are happy with. Very active leg, I even lift my heel if necessary. In the bendy side, and just do a dynamic opening. And in the dynamic opening, you start from the upper body in a little bit into the side, leaning forward. So you can really work into that feeling of moving your collarbone, your hip, the head of the femur, and the upper side, deep into the hip joint. It has a very rounding effect too. Very good. And it will bring freedom into the lower back. Good. I'll start to just go down for static stretch. Move your static back, stay, breathe. Then stay active in the foot to actively lengthen the structure. And you can go with feeling no precise length of hold. You want to feel that aspect of that. I'm going in there. And sometimes it's like that takes longer. Yeah. For example, on the effective leg, you may go in and just need a few additional breaths to create a positive effect. Once you've regulated your adductors, you're going to turn to one side and take what's called a 90-90 lunge. 90 degree to your knees. Make sure you have a really stable stand. Move into that support of the pelvic girdle. I hope you're supported. They have it. Yeah. Take your shoulders back and then lift off the ground. Very good. You want to tilt your pelvis slightly back so that structure needs to lengthen of your psoas. And then keep the positioning of your lower back as you still want to come down. Yeah. Very good. So we did that a minimum of 5 times. And while we do that, we maintain maximum symmetry and lengthen the groins without getting into the compression of the low back. Very key. So while we do that, we automatically already also strengthen the transverse. Go. Minimum of 5. Slowly down and exhale. Collect. And then let's inhale breath. Exhale, slowly release. Inhale as you down and then collect the power as you need to exhale and then with the support of the exhale left. Minimum of 5. Okay, very nice. Switch sides. Start at the bottom so you can adjust your feet hip width apart. You can also stay close to the wall if you need it. Okay, find the pelvic position. That's feet enough to support the strap. Active spread on the feet. Inhale, lengthen, exhale, lift. Unless they want the sides that go a little wider like the stance. Yeah, we extend the leg actively here. And slowly bring it down. Inhale, front. Here it takes effort, yeah. Extending your hip without extending the low legs. And belly draws in. That is the height that lengthens your groin. And exhale, climb, extend. You'll be fatigued under a few times. And same here, if you have a little need to extra length and stay able and expand the leg. Work the eccentric length into the groin. Same time, of course, you're stabilizing, working, supporting. Very nice. And back down. Good. Last one to move up. Swing sides. Have a block ready. Turn your front foot out, bend the knee, and grab your block to the outside. From here, placing the block, hands to the inside. Take a moment to move here, so the eyes back. Good. Front foot stays parallel. Hug your front hip underneath here. And then work it into Trikonasana. So the block is wherever you need it to be. You want to keep your spine long. Okay? Extend the leg. Now, your adductors will over time get a lengthening effect, but what we're focusing on is now the lumbar region. And Trikonasana is just a stand pose to access, when fully done, to access the side, the lumbar fascia, the QL, and bend the knee one more time, lengthen the spine. You can tail a little under without pushing your hips forward. Or make hips stay back. Tail under. So very active legs. And extend. Go. And add it over time. Very good. So I'm not leaning into the front strap yet. You just have the full support to your legs without hyperextending your front knee. Very nice. Hug your belly in, twist, and then take a side stretch. Pull the belly in, pull the front ribs down. And just feel that nice opening here into the lumbar fascia. It's huge. And so affects the positioning of the pelvis, pain perception. And sometimes stretching alone and actively lengthening the structure is not enough. Yeah. Then you gotta find a really good body worker who dares to work deeply into the structure. God. One more breath. God. Stay on. Yeah. Active legs. Good. Root your back foot down to really open that region between pelvic ring and ribs. And then switch sides. Take your block a few up. Good. And push to the inside, drawings back. Okay. And then also here we have the adductors in there, so you may feel that shorter side one more time. And then when you're ready, front heel in one line into the middle arch of your back foot onto your block. Turn your belly to side and working to worlds. Notice the difference left and right. Hand on the pelvis always helps to notice where is your pelvis tilting. You don't want to have it tilt anywhere. Yeah. Hug your belly in, right? To not escape. Turn the belly up. Good. Good. And once you're in the pose and you relax it there to support, turn your belly to side, arm up, and then stretch. Very nice. Good. You root your back foot firmly down. So that active rooting and strengthening, allows you to gain that freedom in your heel now on the right side. Right. Minimum of 5 static round. I'm going to pull the red static. And so with the static action in it. From far away, it's like basically rolling into one pose. Good. Hug your belly in. Work your back leg down. Good. And come back. Very. Bring your legs together all the way. On your knees. Sit on your heels. As an alternative to Trikonasana, or just as an additional pose to do when you can't stand in a room. You bring your knees all the way together and move slowly to one side. Potentially make it like it. Underneath the hips if you tilt. From here, inhale, lengthen your spine. Reach your right arm up and take a side stretch. This is pretty much seated Trikonasana in terms of the effect of your QL, quadratus lumborum, fascia thoracolumbalis. Legs are stay, sacrum stay, on your belly in, perhaps even flag your spine a little. Feel into that. And you get a good idea if there's one side that is more contract than the other. So switch, squeeze your legs together. And hate. Pelvis roots down automatically because of the position. You actively lengthen and then stretch up and over. It takes less effort than Trikonasana. Maybe a pose you can do easily also before bed. In between. Big breath. Never forget the breath. Diaphragm is the opposing structure to the pelvic floor. So make sure you can contract deep. And also you're opening it through the side stretch. Good. Especially in pain situation, what tends to happen is a certain suppression of the diaphragm. And then the whole system gets alert. And now inputs that usually don't cause pain suddenly start to cause pain. The over alert system. So bring it down with your breath. And as a general tip, in pain, when you have pain, let's say you go back, always check the opposing connection. So if you're dealing with sacral issue stuff, check on the opposite direction. What's your psoas doing? What your quadriceps doing, your rectus femoris doing, which we didn't include in this regulation. But just look at the opposing structures also for release. Okay, next move into now strengthening the pelvic girdle supporting structures. So in this part, we gonna look at 5 exercises you can do to support in pelvic girdles, support structure of the pelvic floor, transverse abdominis, deep back extensor. So therefore, the structures that get tightened can release. Okay, we're gonna start by using the My Strength Ability strap as a loop band today. So I'm gonna take it around my upper legs. And I'm working with the stronger version, the full body version, because it's a little wider, a little tougher. It's medium resistance, and therefore just more pleasant on the leg muscles. I'm gonna loop it into last 3, and then tighten it to a point where, just switch, there you go, where I feel in the middle of upper leg, nice resistance when I move my legs further than the foot apart. So when I make it nice and tight for higher resistance, and then I'm just gonna use the amp part and a little bit in to be tight. So if you want slide, and we're gonna start on our 4. So on all 4, just make sure you find a neutral position of your low back first. Some of us have the tendency of tilting the pelvis. There you go. That would be the tilt. Nice, like moving into a lot of longer curve. Others have the tendency of tucking the pelvis, flattening the low back. So I want you to find your balance. For a tuck, the balance may be here. For a tilt, the balance is the opposite direction. And once you feel that, lift your head erect to spine. Inhale, breath, keep either hip width, but you already feel the resistance of the strap. And then exhale, stop your pelvic floor, your belly button slightly up. Gravity will support that. And so you're hovering with your knee above the floor. Inhale, breath here. As you exhale, lift one leg off the floor. Good, just hug. Good, inhale back to center. And without shifting in the body too much, lift the opposite knee. Good, inhale, breath. I'm gonna make a pause, release your knees. This is to add the pause. Tuck your toes under if they're okay, your toes, and just take a break. Back to center. Inhale, exhale, hover. Inhale, breath, lengthen the spine. Very crucial, always keep that length on your pelvic, so belly up to spine is the one leg. Release. Cleanse the opposite leg. And I'm just gonna keep going. Of course, you can take a break every time. So inhale, right center. Soften the upper back, strong arms, exhale. Lift the foot. Both knees are hovering. Inhale, go. Exhale. I wanna have at least 5 times per leg. And as you lift the leg, you want to feel as little shift in your hand as possible. So you're really stabilizing it with your trunk. Okay? Exhale on your right. Inhale. Exhale. Very good. Both down, both knees down, and move back. Before you struggle to maintain the balance, just take a break after each one, and then start fresh and clean. 5 times per leg. With the exhale breath endorse stabilization. Awesome. Just to take another breather, length through the spine and moving into downward dog. And now with the little bend, you will feel you get more actively engaged in outer hip. Hug your lower upper transverse. And just take a deep breath as you bend your knee, thighs back, and lengthen the back of the leg. Breathe for 5. You can also alternate your legs. And our legs are shaking a little because it's a lot of work for the outer hip here to maintain connection and no collapse inward. But that's exactly what will stabilize your pelvic ring to prevent the legs from collapsing and through the resistance, really having to lift the inner leg. Very nice. Good. From here, come on your knees. Shift your weight forward. Find your lower belly connection very slow. Come onto your belly. Come onto your belly. Yeah. Take your arms forward. Like it. Take your finger down. Yeah. All right, again. Push. Untuck your toe. Hug your pelvis. Your shin faces towards the ground. All right. Inhale, breath, exhale. And then lift the right leg. Good. As you lift the right leg, again, try to balance that chin. And we're gonna 5 times pulsate the leg externally. It's a very small motion in this position, but I want you to, besides the support of the back body here, you can hug your shoulders in a little bit more, without compression in the lower back. So while you look down and press the pubic bone down, I want you to find that isolated external rotation in the leg. And we're actually specifically working the piriformis, as it turned out to be an additional stabilizer of the sacrum. Okay? Who would have thought? We tend to really focus on stretching down structure in yoga, which is really good. But also, especially when it comes to a side is function, often that structure is insufficient. And release back, take a break, forehead down. Lengthen sideways, blood shows in pubic bone down, waistline long and opposite side. Left leg lengthens. No compression in lower. Already, if you notice you're shifting, bring it back to center. And then find isolated external rotation. Good. Your glutes are engaged, but they should not take over the main work. A hand press the pubic bone down. Really, the lower belly lifts, you feel the exhale to the leg out. And the leg is working to stay straight into that isolated external rotation. And be on a third on the right. 4, 5, come back and breathe. Very nice. Just to balance, lengthen the spine body and press the back of your feet down to the big cobra. Yes, into a hammock chair. Very good. Turning on our backs now. Release down. Make sure the camera. There we go. Make sure the resistance is there. If you need to tighten it, tighten it. Yeah. I have it around the middle. Of course, the higher you're up, the more range of motion you have. But around middle is good. And I'm going to tighten it a little bit more. Just because I really want to make a point about accessing the outer hip, recruiting those muscles. Good. From here, hips above the knees, lower leg parallel to the ground. Find a curve with the low back. For some easy, for some not so easy. And then add resistance to the thigh. Very good. Inhale, breath, tying body long, lift the head. So you resist, push your leg forward at the same time. You move your belly button towards your spine. If it's too much for your head, you can bring it down. However, breathe, have your belly full, the belly in, all the pelvic floor up as you continuously breathe. If you lift the hand, it helps you to recruit the muscles. And resist. Resist at the same time, and a slight resist into the straps, working going, which will support pelvic girdle. What is it? 6, 7, 8, 9, 10, and release. Second set. Make sure in the break though, you have your curve. You're not slapping in the leg. You grab the curve. I always say, and make sure if there's an exhale below your back, make it survive. Okay? Second set. Here we go. Resist. Doesn't look like much. The more you resist, the more you have to work your pelvic structure, lower belly structure towards your spine and up, finding that length to your entire spine. You see which shape. So try to find that edge there. Go for 6, 7, 8. Keep the resistance on the strap. 9, 10, and release. When you want to build that endurance. Okay, you got to do a third one. Make sure you breathe into the low back, into the chest, creating the curve, and go. Keep the resistance. Legs, feet are active. Feel the lift. And I'd rather have you do less sets and work it properly than 10 sets and not work the engagement. So resist, pull the belly up. Let's go for some extra resistance. 5, 4, 3, 2, 1, go back. Okay? I would say 3 to 5 to start it out, but definitely work it towards 5 to 10 reps. And then last one, we're gonna come into the same position. In fact, you can bring the arms up. Big toes touch, or almost touch, And all you're gonna do is maintain the curve and isolatedly, gonna go diagonal to see it better. Move your knees out. So it's an abduction but also external rotation. It's kind of closing sacrum to sitting bone. And the manos is I'm working quite a lot of resistance here now. 4, 5. Maintain the curve and pause. Okay. Definitely want you to work a second, third set. I do one more. I've already pre-exercised, so I already feel with the starches by now. Okay, ready? Go. And you can support your head too, it's okay. It's a nice way to add more frontal body engagement, so big toes slight touch. Pull the legs apart. 3, 4, 5. Very good. And back to section. And then pause. Very good. And from there you work your stand up. Either lower resistance, more reps, or higher resistance, less reps. I'm just gonna remove the strap. And you're gonna take a nice spinal twist. So bend your right knee in, with your hips slightly to that direction, and then take a twist. Like this is medicine to your spine, to your low back, outer hip, bring some balance back. Also, I feel like there can be never enough spinal twisting, since that is the first motion we tend to lose, is the ability to extend and rotate, especially to thoracic twist. Take a minimum of 5 to 10 reps. And we'll switch sides. Hips slide into the opposite direction, straighten the leg, so it's a supine twist. And when I actually actively immobilize, there's fine-tuning in therapy, and it's very close to this position. So pay attention to what your sacrum region, the back region is telling you. Let your belly twist with you as you breathe deep into your diaphragm, feeling the system support and calming. And last one, just to release the word, is the classic thread of the needle or supine flexion pattern. So very active foot, place it to the top of the knee. Create a curve in the low back. You might just grab a block nearby. And version 1, you grab the upper leg and then lean back as you create that curve back, which for some might be a bit short, or they end up depressing the shoulders. In that case, I recommend you bring the blood underneath the pelvis. You gain some extra space to create that curve, very nice. And then grab it, either lower leg or even with the shin. Really move your pelvis back so your hands a curve. And you can always bring a little more fascia release in, moving the back pelvis here. On the block, roll over it. If you have some spots, you can use the edges of the block. But really the purpose of the block is to give you more curves. A big breath down. Some others that maybe can't get enough of. Big breath down into the belly, into the legs, grounding the system. Okay, switch sides. Good. And make sure the side body stays long enough to compress. And then the other hip. You can't compare the difference with block without block. You will notice that with the little heightened position, we can more easily access extension in the lower back as opposed to flexion. Yeah. There you go. So we can free the curve. There we go. Retrain the curve. Nice. All right. So for today, that was some work how to bring the pelvic girdle supports. If you want to watch the full tutorial, please refer to the link. Thanks so much for watching, and see you soon.